What to do if your pain specialist sucks? Hi, it's Dr. Ruth, the pain doc, founder of Chronic Pain Rescue, telehealth practice dedicated to helping those who suffer from chronic pain through holistic and integrative practices to become pain-free, or at least significantly painless. I see this question come up a lot on the chat and figured I should put some advice to people. First of all, just to say, if your pain specialist sucks, the short answer is get a new one. But I do know pain specialists can be rare to come by, rare to find sometimes. A lot of physicians are getting out of that practice, or maybe if you're a pain specialist you see for your opioid prescription, then suddenly they're gone, they've disappeared. It's very difficult these days. That's why I think if you could have other alternatives to opioid treatment, you're better off, because it's just not only harder to come by, but also there's just so many complications, possible complications with those meds people don't realize. But just to say, before I even kind of fill out this talk, that medicine has changed so much in the past 20 years. Doctors are no longer really autonomous in terms of their treatment choices. What aggravates me, what I don't like, is the fact that it's not a question of what is the best treatment. Many times it's what does their insurance cover. Then those two questions are not the same. Best treatment and what their insurance covers, there's a problem. And sometimes that's just the case. There's a lot of things that can be prevented that sometimes insurances are not covering. And so people have complications that they didn't have to have. If you're seeing someone in the outpatient setting, you spend an hour waiting for them, and then you have 5 minutes in the office. Understand that most physicians are not happy with the situation either. They can get taken off an insurance panel if the insurance panel feels they're not seeing patients significantly quickly enough. We're expected to be fast food, distributors as opposed to physicians. And so often there's just not the time to talk. There's not the time to listen to the patient. And therefore, a lot of things are not getting addressed. You probably already know it's a good idea, if you have questions, to write them down before you come. I wouldn't make it 10 questions, but if you have a top 3 that are really on your mind, maybe you don't understand what your diagnosis means. Maybe you don't understand what is the prognosis for what you have. Write them down and bring them up when you see the doctor. If you didn't get to ask, or if you have information in between that you want further clarification, you have questions, certainly, give the office a call, see if the doctor's assistant at least can get that question answered or get back to you from the doctor. Remember that they're people just like you. You're a person, they're a person. I think, fortunately, medicine has gotten so far away from that, especially when physicians are diagnosing, that they're treating illnesses and forgetting that the person with the illness. I think it helps when, just to ask, how are you doing today? Have a smile. I'm not saying you should bribe them, but hey, maybe a card or two, maybe a box of donut holes for the office, anything that might at least help them remember that you care, you want to be cared for. If things are really unacceptable, if there are other recourses that people do have, you feel that the doctor really made a mistake, maybe you're not looking to sue them, but you want it to be corrected. You want the doctor to be evaluated and maybe corrected by their peers. Sometimes people call their local Department of Public Health, and you can voice complaints there. Also calling the state medical board, and they can do an investigation. And if corrections or needed, they also can do that. So those are some things just to say. And I'm here as a telehealth coach. I am a physician, but I'm also here to help come alongside anyone suffering from chronic pain who wants to get out of that pain, who has a little bit of hope, just a tiny bit of hope that, it is possible to change things for you, that you can live a whole normal life. Pain is in your past. Feel free to reach out www.chronicpainrescue.com to set up an appointment. We're soon to be launching a group program, which I know is going to be life-changing for a lot of people. And if you are interested in that, also reach out on social media. Let us know who you are, and we'll try to get you signed up. Until next time, peace and blessings.